Hi, I'm Kathy Brandt, founder and principal of the KB Group. I enjoy helping organizations identify their sweet spot, that unique opportunity to leverage their assets to achieve their strategic goals. Innovation is frequently used to describe activities, programs, or actions. We throw the word around and talk about how innovative we are, but are we using the word so much we've forgotten what innovation actually looks like? Innovation is solving problems we didn't know existed. Take the Post-it note. It's a great example. We didn't know we needed them until we had them, and now a world without them is hard to imagine. When I first entered the workforce, calls were made from home office or at a payphone. Emails had to be sent during office hours or at home late at night. Smartphones now enable us to make calls or send emails or search for information anywhere we go. A few years ago, Twitter was simply the latest fad. Now it's being used to hype TV shows, market and promote businesses, like mine, and provide a way for people to protest or support causes or outright political rebellions. 35 years ago, hospice was a true innovation, fostered by volunteers who envisioned a better way to care for the dying, outside of hospitals, surrounded by families with expert medical, psychosocial, and spiritual care. Today, the number of patients receiving hospice and the growth of palliative care is astounding. But I'm not sure that's the biggest impact hospice and palliative care has had on our society. Hospice and palliative care systematized the use of interdisciplinary teams, the integration of the patient family as a unit of care, and the idea of patient-directed care, communicating difficult news to patients and families in an honest yet compassionate way, and perhaps the biggest impact of hospice and palliative care is bringing expert, proactive, and holistic pain and other symptom management to people in hospitals, nursing homes, and for those dying at home. About 10 years ago, Jim Collins warned the hospice field to build an economic engine that was not reliant solely on the hospice Medicare benefit. His words seem prophetic now as rates are being cut and CMS and OIG are tightening eligibility criteria to ensure that people who receive hospice are weeks, not months away from dying. Palliative care, which has been widely accepted in hospitals across the country, seems to be struggling to take non-hospice palliative care out into communities where the majority of healthcare is provided. Today, those working in advanced illness management, chronic care, and geriatric care management are building on what we've created and perhaps leaving us behind. Now, with the influx of baby boomers entering Medicare and the fiscal future of Medicare in danger, there's a tremendous need for what we have to offer. Hospice is available across the country, yet it is time limited. Palliative care is becoming more widely accessible, but it is still primarily offered in hospitals or through large community hospices. How can we help create community-based palliative care models? And why hasn't it already happened? Is the Medicare hospice benefit, once a controversial idea, now a sacred cow that must be protected at all costs? Obviously, it is vitally important, yet we must also create palliative care funding streams without viewing them as threats to the hospice benefit. We've always been a field of innovators, bringing hospice to nursing homes, caring for people with HIV before we knew how it was spread, caring for people living alone without caregivers in their home, serving the homeless and other disenfranchised. Yet we can't seem to get beyond the roadblocks of the 6-month prognosis, people associating hospice with imminent death, contracting with hospitals to provide transitional care for people being discharged. There are few programs innovating, but compared to the rapid spread of innovative ideas that has marked our history, we seem slow and sluggish, reluctant or unsure of how to go around, over, or through these roadblocks. People in the hospice and palliative care field have lots of great ideas. We are very creative. In any gathering of professionals, you'll hear a myriad of great ideas as to how to solve these issues. Yet the innovation is happening slowly and in isolated pockets around the country. The big question is, how can we, as a movement, work together to create breakthroughs and spread innovation? Programs need to learn from those who have already figured out how to overcome these roadblocks. They need templates and guides to help them through the process of implementing good ideas. They need to dedicate precious staff and financial resources to developing new models and perhaps failing a time or two until the right model with the right partners comes together to create a sustainable program. We can be a solution to the many challenges facing our healthcare system. The KB Group is ready to help your organization transform great ideas into winning solutions. With nearly 25 years of national experience in hospice, palliative care, aging, and caregiving, I know how to help organizations identify opportunities to transform the services you provide. I started the KB Group because I'm committed to ensuring access to high-quality care to those living with serious, chronic conditions and those who are in the final months of life. Please contact me so we can explore ways the KB Group can help your organization survive and thrive during these challenging times.